Hello, everyone. My name is Paula Davis. I have a bachelor's degree in psychology and am a qualified intellectual disabilities professional, as well as an administrator for intermediate care facilities for the intellectually disabled. Today, I will be speaking to you about an article titled Meeting in the Middle: Improving Communication in Primary Healthcare Consultations with People with an Intellectual Disability by Jenny Zivian, Nicholas Lennox, Heather Allison, Michael Lyons, and Chris Del Mar, published in the Journal of Intellectual and Developmental Disabilities in September of 2004. I chose this article because it relates to the field about which I am very passionate and ties in nicely with some of the communication topics about which we have been studying. The article begins by putting forth the premise that a major obstacle to the provision of appropriate care is seen as inadequate communication between the GP, the general practitioner, and the person with an intellectual disability. This study used interviews and observation to perform a qualitative study. They admit that though not normally generalizable, this type of study can yield data for areas with little previous research and can give a good idea of some of the more complex variables at work for use in further study. The sample size was 17, with 5 GPs, 3 adults with intellectual disabilities, 7 paid support workers, 1 parent, and 1 advocate. They were asked about communication, barriers to communication, and suggestions for improvement. Responses from the intellectually disabled persons centered around feelings of not being included in the discussion. They felt that they weren't part of the conversation, that they weren't being given eye contact, and that often the provider was rushed and didn't spend enough time. Provider responses focused on communication, difficulty in getting a good diagnosis because the person with the disability could not tell them what was going on, either due to an inability to communicate altogether or low literacy, not enough vocabulary to be able to express what was going on. They also complained of a lack of time and not really understanding fully the concept of informed consent for this patient population. Support persons and advocate responses focused on the sense that the person with the intellectual disability was not receiving the same quality of care as others. They also talked about logistics issues, for instance, locations of provider offices, exam rooms, and maybe needing a waiting room that provided a quiet place for a person who maybe doesn't wait well. They also touched on provider interaction and suggested that providers should make eye contact with the person and also provide improved education so that they would know what to tell the provider to help them in the diagnosis. Through this study, the authors developed the Meet in the Middle model. They used this model to address the issues identified in the study. And they focus on a need for collaboration and improvement in 5 key areas. The first one is training of personnel, improving accessibility, improving preparation, improving sharing of information, and assuring appropriate follow-up to make sure that proper recording and communication of decisions and treatments is being passed down to everyone involved in their care. The issues I found with this study were twofold. First, the sample size only included 3 people with intellectual disabilities. It was not an equal sampling from each of the 3 people involved. Second, physicians were those with experience with the target population. They did not include anyone who had minimal to no experience with the target population. For discussion questions, first, what do you think managers can do to better prepare providers for communication with this client population? Second, what strategies can managers use for care providers to assure that they are prepared for clinic visits? Third, how can we as a society improve how this population is perceived by healthcare in general? Fourth, have you ever had an interaction in your workplace that involved trying to communicate with an intellectually disabled person? How were you able to understand and make yourself understood? If you were or are a healthcare practitioner, what tools would you like to have available to improve communication during encounter with this patient population? In conclusion, the study found that providers need more training to be more accommodating to the special needs of the disabled person and to be more patient focused talking directly to the patient rather than just the caregiver, using tools to help explain things to the patient. Caregivers need to be more prepared with medical histories and written documentation that can be reviewed regarding the current problem. Documentation and follow-through on the part of the caregivers after the visit is severely lacking, and providers can be partners in improving this by asking that observations and documentation be brought to appointments. Given the plethora of information regarding provider-patient communication, I was surprised to see so little research being done into this particular provider-patient relationship. In the review of research I did for this population, I found that all too frequently, individuals with intellectual disabilities are not included in the actual studies. Often the interviews are conducted with providers, caregivers, patient advocates, and social workers. I was pleased to see that the authors of this study spoke directly with the disabled patients. From my point of view, that makes this particular study more meaningful and likely more generalizable, even given the small sample size, than other studies I reviewed as possibilities for this presentation. I found this article extremely useful, and I hope you find that the information in it is applicable to what you do as well. Thank you.